Well, this evening's presenter, Taryn Katz, has assisted countless number of people, countless number of men who've attended our support group over the years. I've been a member here for about 10 years or so, and just about every time we come along to a support group meeting, there's some mention made of Taryn and the great assistance that she's provided to our members. So thank you for that. It's all been good stuff. Taryn's a regular presenter in our yearly program. Her presentation, I think, offers something to everyone as we are advancing in our years. Who knows? You know, we can get problems and need to do something about it. But in particular, her session provides information, important information for any man who's been diagnosed with prostate cancer, and there's a message for both pre-treatment, during treatment and after treatment, I would think. Yeah, so that's an important message. As you'll learn or be reminded, because some of you have been to Taryn's sessions before, pelvic control, continence control depends, I'm sorry for the pun, depends so much on pelvic floor muscles, strong pelvic floor muscles. And there are times when men will perhaps require other interventions, and it's important for you to know that there is always something that can be done about incontinence, and that you don't need to be wet. And we have a range of information that's available to you both through our pamphlets that we have here upstairs and the library downstairs. So there's heaps and heaps of information for you. Taryn is a pelvic floor physiotherapist. She works in her own practice and has been doing so for the last 12 years at both Hornsby and Pymble. So would you please welcome Taryn Katz.
Welcome. Thank you once again for inviting me to talk to you, and hope you find it all interesting. We're going to talk about gaining bladder control with physiotherapy. And just an overview of the talk tonight. We're going to look at lower urinary tract symptoms, which we often call LUTs. Pelvic floor muscles, of course, prostate cancer and incontinence associated with that, physiotherapy treatment, and of course bladder control. Is this microphone okay? Yeah. So, someone sent me this via Facebook. So you can see that cartoonists and comedians all find incontinence very funny, but for the person that's having problems, it's not such a laughing matter. And having that kind of accident is very embarrassing, and what a lot of people, of course, we don't want anything like this to happen, and then it might be, well, I'm living with the dreaded pads, which, you know, is not what we want either. And of course, you know, our biggest fear is that we might age and have incontinence and land up in nursing homes because of it. So it's something that we want to prevent. Get rid of these pads or reduce them at least. And so physiotherapy offers us hope, it offers solutions. I think the thing is that incontinence can be very lonely for people. People then stop wanting to go out for fears of accidents, or maybe they don't know where the toilets are, and so they stop attending social events, and it can be very isolating and depressing. So causes that might be, well, of course, one of the big ones is the aging process. So we're not immune to that, but as we age, and women and men, incontinence can get worse. But in men, they have an enlarged prostate that can also affect continence. This is when the prostate really enlarges. It can encroach on the bladder. We call it benign prostatic enlargement, BPE, or benign prostatic hyperplasia. And that can cause some havoc because it can lead to what's called BOO, which is bladder outlet obstruction. And there we'll go into the signs and symptoms of that as well. Causes of incontinence are not always related to prostate cancer, because in the prostate, the cancer grows a lot in the mid to outer lobes, where with the BPH, it's going to grow more in the inner lobes, which then going to cause some restriction and on the urethra, and therefore going to cause some obstruction. Men might have both. They might have an enlarged prostate causing symptoms of lower urinary tract symptoms, and at the same time have prostate cancer. Sometimes they might have prostate cancer with no symptoms of urinary problems. And of course, you know, if you do have an enlarged prostate and you have got problems with your flow, urgency, etc., then you might have a TURP, which is a transurethral resection of the prostate. It's like kind of a boring operation. They go in and they scrape out parts of the inner lobe, so they widen the urethra so that you get a good flow and it doesn't obstruct you. Sometimes they do it with a green light laser as well. And of course there's a radical prostatectomy. This is going to have an effect on someone's continence. And if you do have prostate cancer but don't have a radical prostatectomy, or you've had a radical prostatectomy and the cancer comes back, you might have brachytherapy or radiation therapy, which is also going to perhaps cause a bit of havoc with incontinence. So, some of the symptoms, some of the women in the audience might relate to some of these symptoms, which you might get is frequency, running to the toilet all the time. Urgency, that real feel of needing to go, where you can't hang on. Nocturia, that's waking more than once or twice a night to go to the bathroom. Hesitancy, men get it with this obstruction, so having difficulty initiating or starting the flow. You might have an intermittent stream where it stops and starts. Terminal dribble, which means it just keeps on going. You just can't seem to shut it off. And after dribble, a lot of men might relate to that, where they think they've finished and then pull up their trousers and they get an extra drop or so. And of course, you can have urinary incontinence, which we'll talk about the different signs and symptoms of this. So if you do have lower urinary tract symptoms, you are going to, let me see how this works, get some bladder dysfunction. And so firstly, with that obstruction, you are going to get the hesitancy, the weak stream, the straining, the dribbling, but equally this can lead to symptoms of what we call an overactive bladder, and you're going to get the urgency, frequency, waking up many times a night, and also maybe having a leak getting to the toilet on the way when you have a full bladder. And it's quite common. So you can see here, this is a graph of men in different ages, and you can see the different colors going from even a 45 to 49-year-old. So those are the dark purple, but these symptoms can be in quite a young age group of men. It's not always older men, but you can see that as men age, obviously there's going to be many more men with these symptoms. So what's the prevalence? Well, in Australia, 1 in 3 women will have incontinence, but 1 in 10 men will also have some form of incontinence. As we said, with the aging process, it's going to be more severe over the age of 75, and up to 40% of this age group will be affected. But I think the really important message is that it does increase with age, but it can be successfully treated and managed at any age. Okay, and I think that's the important, one of your take-home messages. All right, so how's that little joke? Okay, I couldn't find a men's one, but you can all kind of relate to this. And this is called stress incontinence. So this is where men sometimes after radical prostatectomies, they might cough, they might stand up out of a chair. A lot of men tell me they find when they're sitting or lying down, but the minute they start walking or bending or coughing or sneezing, then they have a problem, and that's called stress incontinence. But, you know, how many of you relate to this one? You know, that real, with that urgency of needing to go, and then there might be some urge incontinence related to that. And of course, you know, men and women, this frequency of running to the toilet. And knowing where every toilet in every shopping centre, mall, every, you know, place in Sydney, and there's actually a booklet which is quite good that's put out, that's where I got this picture from the Continence Foundation, for people who have issues with incontinence, of knowing where they can go and use the loo. So what does physiotherapy offer? Well, we're going to offer conservative management for the treatment of incontinence. Obviously, it's a first port of call is to come and try this first and see if you can get any results with physiotherapy, and we do quite well. But if not, then there are surgical options. When you come, you're going to have a detailed assessment so we can work out what your issues are. There are a number of treatment modalities. We offer education, advice, and very importantly, some ongoing support, so you don't have to feel alone with it. So where are these muscles? Okay, so the pelvic floor, this is just a side view, and we're looking at the pubic bone right in the front of you, right low down, and your little coccyx or tailbone right at the back of you. And these are the pelvic floor muscles. So we have the urethra, there you go, through you urinate. We have the prostate, and we have the bladder, and over here we have the bowel. And these sitting right underneath you, and I've got some more pictures, those are the pelvic floor muscles. I will talk a little bit about the lower abdominal muscles, which you can see over here. And these ones are sitting right down below you. So they attach from your back, they come all the way to the front and attach into the top of the pubic bone. Very important. So we're not talking about the six-pack. We're talking about the very deep lower abdominal muscles. So your pelvic floor. It's very important. It helps to maintain continence of both bladder and bowel. It responds to increase abdominal pressure, like when you cough or you sneeze. That pressure down, your pelvic floor should come up. It gives support to the pelvic organs, and it's important for sexual function as well. It relaxes when we need to empty both our bladder and bowels. So this is a picture of your bladder. So your bladder is just a muscular structure. It's kind of like a balloon. So when it's empty, it's small, and as it fills with urine, so it's going to expand. It's just a storage vessel. But right down over here at the base of your bladder, we have this area. You can see it's like a little bit of a triangle, and that's called the trigone. And the ureters from the kidneys actually come in at this level. But there are a lot of sensory nerve fibers around here. And so when you do go to the toilet and you relax your pelvic floor muscles, some urine gets right into this top bladder neck, and it's going to tell the bladder it can contract down. Equally, when you've finished urinating and there's no more urine passing this area, you pull up your pelvic floor muscles, and that kind of tells everything to switch off. So it's a very good mechanism. Now, we all have sphincters, and I don't know if you've heard about the urinary sphincters. You might have come across them, but men and women have them. So we do have a internal bladder neck sphincter right at the top of the bladder, and we have another one which is with the pelvic floor muscles. Now you can see this is the woman. We have a very short urethra. We're relying a lot more on our pelvic floor muscles to keep us dry. But men have a very long urethra, and so they're often not relying on it until there's an issue or problem, like you've had surgery. And then you now need to know a lot more about your pelvic floor muscles and how to use them, and hopefully that can help to keep you dry. The internal bladder neck sphincter up the top there, that's not under our conscious control. You can't say, like to put that sphincter on. That's just working for you automatically. But this external urethral sphincter, which sits with the pelvic floor muscles, that is under your conscious control. So you might have tried this in the past, but if you go and like the phone's ringing and you're busy urinating at the same time, you might be able to stop that flow. And you're doing it with pulling up your pelvic floor muscles and shutting off the flow. Now, in the past, we used to think that the sphincter was like a round muscle, but it's actually not. The external urethral sphincter is more like a U shape. Can you see that? And if you think of this as the urethra, then coming in the front, like this horseshoe shape, so it comes in the front, this is the sphincter, and it sits below the prostate. But coming in at the back, so we have those coming in the front, that's the sphincter, but coming in the back, we have these very deep pelvic floor muscles. So this is just your pelvis, and this is the deep layer. We'll talk more about the more superficial layer, but this is the deep layer of pelvic floor muscles, which is aptly named the levator ani muscles, which is Latin. Anyone know Latin? But it's Latin for lifting the anus, and that's exactly what it does. It draws up the anus, you might feel when you do a contraction, towards your head. So when they work together, we get the lift with the deep pelvic floor muscles, and that lifts the bladder neck, which is very important for continence, and we get the squeeze of the sphincter and the pelvic floor muscles together, which kind of gets extra closing force around that urethra and helps to keep us dry, especially if you're going to cough or sneeze or move. So, prostate cancer, surgery, radiation. Well, the surgery can affect this bladder neck. So when you have the surgery, the surgeon's going to really cut just at the base of the bladder, and that internal bladder neck sphincter is often gets traumatized and damaged. But it will also happen to men that are having that TUR procedure as well. But it's not the one we solely relying on. We still have another sphincter down here with the pelvic floor muscles, but it certainly can affect it. You know, this is the bladder. Below that is the prostate, and all this spaghetti-looking thing are the nerves. So oftentimes the doctors will try and do nerve-sparing operations and save these nerves. So they're going to cut away very carefully, and if they can, try and save the nerves. The nerves are really for erectile function. They're not going to affect your continence, but they will affect your erectile function, and sometimes they can save all of them, sometimes they can only save half of them, sometimes they can't save any of them, but your surgeon will obviously discuss that with you. And there we go. This is one of the things that no one talks about with prostate surgery, is that it can shorten the urethra and therefore shorten the penis. And so some men find that after the surgery, because they've cut here and because they've cut below here and they've joined these two areas together, the length has to come from somewhere. And so some men notice that their penis looks a lot shorter. And it can be very distressing because it can really get so short that it's very difficult to you know, urinate into the toilet, or, you know, because it kind of, you know, you're urinating out instead of down, and that can be a real issue. As well as some men that are on the hormone therapy, that's as well, it takes away your testosterone, it decreases your muscle strength, but also might have an effect on the penis as well. And so then the pelvic, when they do the surgery, the surgeons these days, they're a lot better at identifying the external urethral sphincter and really trying to save as much of it as they can, or all of it that they can. And this is really important. When I first started many years ago, there were a lot more men that were really having terrible issues with incontinence, and you know, men having surgery now seem to be having less issues with it, but it certainly can traumatize and affect that sphincter, so that men having the surgery might have some degree of incontinence post-radical prostatectomy. Sometimes it's because there's some swelling. You know, if you ever hurt your Ankle, anyone sprained their ankle in the past? Yeah, I see a few nods. You might notice that when you wake up in the morning, it's looking quite good, the swelling's down, but how's it feeling at the end of the day? Yeah, it's more swollen, it's sore, it's tired, doesn't want to work as well, and this is the same thing. You've had surgery, there's swelling inside, it takes time to heal, and so a lot of men find that in the morning the incontinence isn't too bad, but at the end of the day it's a lot worse. Plus, you're now relying on these pelvic floor muscles, which haven't had to do a major role, so now they fatigue at the end of the day, and it's, you know, morning they might feel quite good, and you've got you know, quite good control, but by the end of the day, you're noticing that you might be leaking quite a bit, and we need to build up the endurance of the muscles. And well, unfortunately with radiation, there is some trauma because the radiation and where it is targeting is right by the external urethral sphincter. So it's a good idea for men undergoing radiation therapy to keep exercising their pelvic floor muscles, even if they don't have any symptoms of incontinence, because when you pull up your pelvic floor muscles, you actually are increasing the circulation to that area and then hopefully helping with healing of the tissues that are being traumatized by the radiation. So now we're going to look a bit more at the pelvic floor muscles. And so we noticed before in that other picture we were looking at those deep pelvic floor muscles, but there are also these superficial pelvic floor muscles that are really important as well. So when you do a pelvic floor exercise, one of the things you might try and do, we don't want to do this as an exercise all the time, but you can certainly test and see how your pelvic floor muscles are working, is to stop the flow of urine midstream. If you can stop that flow, then you've got quite good pelvic floor muscles, and you might be able to stop it, hold on to it, and we really want you to start again and finish urinating. But if they're very weak, you might only be able to stop it for a second and not hold on to it, or just slow the flow down and not stop it altogether. If you find the flow is going faster, you're doing the wrong thing, okay? You're pushing down. That is wrong. It really needs to pull up. And it also feels as if you're stopping wind or diarrhea from the back passage. So both of those are happening together. So when you do it, you're going to feel a lift, tightening, and a lift of the anus towards your head. You might feel, which we want, the scrotum with more the superficial muscles, the scrotum and the testicles lift, and the penis lifts and retracts as well. So you get all three things happening together. And then you know, yes, you're doing the right thing. So we might take a little bit of time to do some pelvic floor. So posture is very important when we do pelvic floor, so let's all sit with good upright posture, away from the back of the chair. Wake up. Yeah, move yourselves a bit forward. So, yeah, right to the edge of the chair. Don't fall off, but move forward. Perfect. So if we're going to slump and try and pull up your pelvic floor, don't bother, okay? We really need good upright posture. Our pelvic floor works better that way. And let's really try and lift, pull up. See for the men if they can feel the anus lifting, feel the lift of the scrotum, testicles. You might get one, might get two lifting. Feel movement of the penis as well. It's a lot harder for us women. We don't have bits and pieces that kind of move that way. But we really want to feel this lift. Now, when you do it, make sure that you're not using those tummy muscles at the top. They don't move. So we're not sucking them in to lift up. You should just feel almost below your belt that those muscles are moving in gently. Let's all stand up and see. Get you awake. There we go. All right, so good upright posture. Yeah, and let's see, can we pull up and draw up your pelvic floor? Anyone not feeling it? I won't ask. Okay. Okay, you can sit down. Hopefully you all felt something. If not, you can find me afterwards. So it's very important. And as I said, just awareness of the low abdominal muscles. So men, actually, you can do a really good self-examination of yourself. You can use a mirror lying down and see if you can see the lift of the scrotum and the penis, as well as the anus lifting. You can stand a really good exercise is to stand in the bathroom. Hopefully you've got a big enough mirror without your clothes on. Might be a bit scary, but try it. And we don't want to see the sucking in of the belly. That's not it. You want to see a very small amount of movement just in the lower abdomen, and you want to see, can I get a lift of the scrotum, the testicles, and a lift and retraction of the penis. And doing that in front of a mirror is very good biofeedback to see that you're actually doing it correctly. I do see some men post-surgery and they do a contraction and they leak. Because instead of pulling up these muscles, they are pulling up, but they're pushing down from the abdomen as well. And there's the law of physics. Who's good at physics? You're all going to be good at physics now. Okay, because if you have a pressure in the bladder, or a pressure coming down on the bladder, which we call the intra-abdominal pressure, we need a stronger closing force around the urethra, and that's going to stop leaking. If the pressure coming down on the bladder is stronger than your closing force, you're going to leak. Okay, so you've all passed Physics 101. All right. And our exercises can be done in sitting and lying and in standing. So really, there's no excuse. You know, we sit all day. You can do it after, you know, in the shower. You can do it sitting at a table, at a desk. You can do it lying down before you go to bed. So lots of opportunities to fit in these exercises. Now, yeah.
There's something, I think, isn't there, about letting off gently rather than letting off with a bang? What's the pros and cons?
The thing is that if you're going to let off very quickly and push down when you let go, you might cause a leak then. So we don't want any jerking or pushing down, okay? When you pull up your pelvic floor muscles, you don't have to let go slowly, but you just have to let go without any force or pressure coming down. Yeah. I mean, when you go and urinate, you know, you don't let it start slowly. You just want it to start. So you have to relax the pelvic floor muscles, you know, at that point. But when we, equally, we need quick muscles when we going to cough or sneeze. They can be quite sudden or move suddenly. And this is often a problem with men post-surgery, is that the muscles, that reflex action of the muscles coming in quickly might not be responding as well as they should, and then we have to work on those type of exercises. So we do need to learn to do them, we do need to learn to do a muscle contraction correctly. This is really important, and if you've got any issues, you need to go and see someone about it. Our aim, this is pre-surgery, is also to, if we have time, is to strengthen and improve the endurance of the muscle contraction. Okay, sometimes I see people 6 weeks or so before the surgery, and then they've got time to really get into a program. Sometimes I only see them a week before, so this might have to wait till post-surgery, you know. We need to learn to do the muscles with functional activities, which we'll talk a bit more about post-surgery. The lower tummy muscles and the limbs. I mean, sometimes people really struggle to get out of a chair because their quads are weak, and then in that efforting of trying to stand up, they might cause a leak. So it is important to just improve your general fitness and health. And of course, as we saw with doing our exercises, we really need to have good posture. So post-operative, well, very importantly, we don't want any pelvic floor exercises while you have a catheter in. So, you know, they've just done this delicate operation. They don't want any flexing of these muscles around a catheter. They want this area to heal. So it will be working gently like normally, but they don't want any forceful contractions. And so once your catheter's been removed, that's when you're going to start your pelvic floor exercises, but you need to start slowly. And the aim initially is really to get the muscles going and to improve the circulation, which helps with healing to that area. And so for that reason, we also always respect pain. I've had men in the past that have, when I've said do it 3 times a day, your exercises, they say, gee, what's she talking about? I'm fit, I should do it 33 times a day. And all they're going to cause is pain because they're overusing the muscles, over-fatiguing the muscles, and in fact make symptoms worse because the incontinence might be worse because of that fatigue as well. Okay, so start off slowly, you'll get there. So our rehabilitation program is obviously going to be an intense exercise program. And when we do the muscle contraction, we're really looking at quality. And I'm sure I can talk to all the men in the room when I say, if you wanted to strengthen your biceps, would you do a little weight like this little thing? Would that strengthen my biceps? Don't think so. But if I really wanted to, I'm going to really put power and strength behind it, okay? Without using other muscles, without causing pressure down, but just tightening and lifting and doing a maximum contraction and trying a bit more than your maximum to really improve the muscles. And it takes time for muscles to improve in strength. It doesn't just happen overnight. It can take, 6 weeks for muscles to change and to be noticeably stronger. We need to look at an individualized program. What is your lifestyle like? Are you the type of person that likes to garden and do golf and play tennis? Then we need specific exercises targeting that, as opposed to someone else who has a much more sedentary life, who's not doing all those outdoor activities. And then we need this functional use of the muscle. So, men come to me and they say, every time I stand up, I leak. Well, you've got to learn to tighten the muscles before you stand up. You've got to learn to engage them when you cough or you sneeze. You'll often read about it. It's called the knack, but you need to tighten up before you're going to do things like bending and getting dressed and all the functional things that you do at home. We need to have our pelvic floor muscles on to varying degrees with that. We need to retrain the bladder, and sometimes men have the surgery. They might have had, all those urinary symptoms beforehand and have not had really great bladder capacity or, had signs or symptoms with that before the surgery. And we need to make sure post-surgery that we get a good functioning bladder capacity and it's, you're not running to the toilet. And it's quite common after surgery for men to actually go more frequently to the toilet, wake more frequently at night, but we want to improve that. And so a program might last. Some men come and see me and these days they might be dry even after the surgery, but we need to get the bladder function back. They need to know how to progress their exercises, getting back to sport, etc. But for some men it might take a bit longer to get there. So, come on guys, we need maximum contractions. So we're looking at doing your exercises. Realistically, the research has shown that if you do them 2 or 3 times a day, really good, significant, strong exercises, you will build up your pelvic floor. And we're looking at doing the exercises, being able to hold for 10 seconds. Initially, you might not be able to hold for 10 seconds. It might be that you start off, you can only hold for 4 seconds. That's okay. Each week, try and add on an extra second till you can reach 10 seconds. Having about a 10-second or so rest in between, maybe even less if you want. 8 to 12 of the fast contractions. And these fast contractions are not just little twitches. We want them squeeze up, relax, where they're strong, where they're fast, but you don't leak when you're doing it. So you're not jerking the rest of your body and causing pressure downwards. And as we said, we can do them in a number of positions. You can make up positions. You can do them on hands and knees. You can do them in all sorts of ways, but those are the main ones. So what about that? Yeah, how true is it? We don't use it, we lose it. Okay, so let's talk a little bit about good bladder habits. So we should be drinking enough. And a lot of people, unfortunately, when they start having problems with their bladder, there is fear of leaking, and they think, well, if I don't drink, then I won't have to go, or I won't have the same problem. But that's not good. And it's not good for your body, it's not good for your bowels, etc. So you need to make sure you're drinking about 1.5 to 2 liters of all your fluid in a day. So that's, you know, a lot of these beauty magazines say you have to have it as water, and then people come and they wonder why they're going so frequently to the toilet, because they're having 8 glasses of water plus their tea and their coffee and their juice. In the end, they're having like 3.5 liters of water. So, I mean, if you're really exercising and sweating a lot, you might need a bit extra. And our kidneys are very good at telling us when we need to drink more. Firstly, you'll get thirsty. Secondly, if you notice the color of your urine, you might notice that if you're well hydrated, it's going to be the color of champagne, very pale. But if you're dehydrated, it's going to be more like tea. So which do we prefer? Champagne. So we want nice pale urine. If you have a problem with urgency, then you might need to avoid the caffeinated drinks, okay? Because caffeine is a stimulant. It does tell your bladder it needs to go. It's also diuretic. It does fill up your bladder more, and some people are more sensitive to it than others. And sometimes it's the timing of it. You know, if you going for a walk and you're finding that you're struggling to come home because your bladder's full on that walk, etc. But maybe you've had, you know, you've had your medicine, so you've had water, and you've had some juice, and you've had 2 cups of coffee, and now you've gone for your walk. Well, guess what? Your bladder's filling majorly on that walk. So maybe it's like looking at managing your fluids before you go on a walk, making sure that you might have a little bit of water first, go on your walk. If it's a long walk, take some water with you, and then come back and make sure then that you make up your fluids. And you might find that that helps and solves some issues. Well, alcohol. The problem with alcohol is that it is a muscle relaxant. It's also a diuretic, so it fills up the bladder quite quickly. Beer, you know, and even light beer, you know, that you need to go maybe a bit more frequently. But it's also muscle relaxants. And so men find that after the surgery, if they're tired at the end of the day, and their muscles are tired, and they add alcohol to the equation, they're going to have a hard time. All right, and so I often warn people about this. It's not to say it's going to cause any damage, but you've got to be prepared for the consequences of maybe having an extra pad or going a bit more frequently when you had alcohol, or maybe even just sitting down, not standing up, because, you know, sometimes men have embarrassing situations with that. So we like to say this, avoid going just in case. You know, a lot of people, when they have bladder issues, they start running to the toilet all the time, and all that does is keep the bladder capacity very small, which is not helpful. So try and see if we can hang on a little bit. We really need to empty without straining. A lot of men tell me, though, that once they've had this radical prostatectomy, they've never had such a good flow and good empty for years. So I suppose that's one good advantage. But if you have that obstructive problem with the enlarged prostate, you might need to take a bit more time to make sure that you empty properly. You know, sometimes people waking more at night to go to the toilet, and so if that's the problem, then try and drink more in the morning, early afternoon, and less in the evening and before going to bed. And so we actually can even stop drinking 2 hours before going to bed. You can empty before going to bed, and then you might find that you get more hours sleeping, only waking maybe once a night. So as we said, when we tighten up and squeeze the urethra, we do tell the bladder, it has an inhibitory effect on that bladder muscle, and it actually tells it to keep quiet. And this is important because I'll teach you a couple of urge control techniques, and that's one of them. When you feel that need to go, you're going to pull up your pelvic floor muscles, and that hopefully is going to maybe quieten your bladder down. But when we do bladder retraining, we try and get a normal bladder capacity. We want to get, you know, at least on a normal amount of drinking. This is not fluid restricting, but on a normal amount of drinking, we want to get at least a 3-hour interval between needing to go. And so sometimes I do bladder drills, which doesn't mean I drill into your bladder, but we do bladder exercises, and you know, I monitor that. We need to make sure that we are drinking enough fluid, because if you're not drinking enough fluid and your fluid is very concentrated, it's more acidic to the lining, and maybe that is also causing an issue. We need to decrease the caffeine and use the urge control techniques. So one of them might be that you sit down and you really pull up your pelvic floor muscles, but another one, which I don't know if anyone knows about, you can raise your hand if you do, is to curl your toes. You can all try that now. Curl your toes. And that actually has an effect on a nerve that comes at the back of your ankle. And it actually quietens your bladder down around at a spinal level, and it does work.
Is it before you get cramp in your toes?
Well, yeah, it can cause cramp, but you know, it do it more slowly, but it does work. Even coming up on your toes, as long as your balance is all right and you're not going to fall over, that works as well. So that's a good little tip for you with urgency. Yeah, learn something tonight. Yeah. So if you ladies want to, you know, if you have urgency, you can cross your legs. Come on, let's all try. Sit up tall. Pull up your pelvic floor and curl your toes. Yeah, that bladder's going to settle down really nicely. And then you're going to wait till it's settled and then get there, instead of charging off in a mad panic to get there and then having issues. And I think, you know, this is a big thing as we age as well, is to think about decreased mobility. If you're struggling, if you've got a sore hip or a sore knee and you can't walk as fast as you can to get there, you know, this is an issue that has to take into account, that you don't leave going till the last minute, and then it's going to take you a little bit of a walk to get to the loo. So you have to factor that in sometimes with people that are really having difficulty with this. So, I should have changed that to Taryn. A lot of men suffer from this. This can even be unrelated to prostate cancer, but it's a little bit of dribble that you might find that happens after you finished urinating. And it does affect quite a lot of men. And pelvic floor muscles are very good for this. And I'll show you a diagram after this, but the other thing is milking the urethra. So what happens is that you get like some urine, that's your prostate, that's your bladder. This is the urethra through which you're going to urinate. And some urine kind of gets stuck there. And so when you finish and then start walking away, you lose an extra little drop. So one of the things is that if you pull up your pelvic floor muscles, remember you get that lift. And that's like lifting a hose straight, and a few more drops might come out. That is the only time that a few more drops might come out when you're doing a pelvic floor contraction. Okay? At other times, we don't want any leaking. But this isn't really leaking. This is just clearing the urethra. Okay. Another thing that you can do, men, is called milking the urethra. So you can put your thumb behind the scrotum, between the anus and the scrotum. Put your finger there, and you're pushing up right on this area, and you're going to push up and push forward, and that can also help clear it. But the pelvic floor muscles have been shown to be as effective, really pulling them up. So we need to keep active. You know, don't let incontinence stop you. It doesn't help. If we do nothing, we get weaker, muscles get weaker. Not helpful. You need to get out, get walking, do some exercise. You don't have to take up maybe this type of sport, but it might be that you take up bowls, or maybe golf, or maybe go and do some Tai Chi, really good, or yoga or Pilates, something. And all of those are really good for helping to strengthen your pelvic floor muscles. So it's achievable. And I'd just like to thank Dr. Pauline Chiarelli for some of her slides tonight. Thank you.
Good evening. I had radical prostatectomy here 10 years ago at this hospital, and after a few months the PSA was rising and I had radiation. I recall at that time all I was concerned about was staying alive, and
yes.
Pelvic floor exercises didn't really figure too greatly, but I did do some before the operation and probably afterwards. But 10 years is now up, and the surgeon said to me that I may have some sort of troubles in about 10 years, and he mentioned the sphincters. And 10 years is now up, and I'm thinking, is it inevitable, or is it? I mean, I've had no troubles. I've had a dream run as far as continence goes, and I'm just wondering now 10 years is up. It's like a 10-year, 100,000K service, or
I think you've done great. I wouldn't worry about it. But having said that, I do think, I don't know if there are any studies that have shown this, but I do think because you've had the radiation, because you've had prostate surgery, we saw in those slides that as you age, incontinence in men generally and in women creep up. So I think it's very relevant that you keep these muscles strong forever. Whether you have incontinence or you don't have incontinence or you've overcome incontinence, I think it's very, very important that you do your exercises and keep those muscles strong. It takes time maybe to build them up, a bit of effort like those 3 times a day to build them up. But once they're nice and strong, it takes less to maintain them. But I think doing your exercises once a day is really worthwhile. Doesn't take much effort. It's the same as we look after our teeth and our hair and our skin and whatever. Just do some pelvic floor. Yeah.
More questions?
I just wanted to ask, apart from the physiotherapy, what are there other interventions? I'm looking at it from a female or male point of view. I did read somewhere about Botox injected somewhere into the neck of the urethra for females. And I just wondered, is there anything that not that works as well as this, but what is your view on these things? And the other thing was, is it not radioactive? Some kind of pulse therapy, particularly for women that I had once. Could you just give an overview on that, if that's all right?
Yes. So some people do have a condition that's called OAB, or overactive bladder. And sometimes there is medication that you can try. There's some patches or tablets that you can take. But it does work well with physiotherapy and those urge control techniques and whatever. Sometimes you're right, there is, we can use electrical therapy as well that has an effect on the nerves. I often, lend out machines, TENS machines, and people wear it around, sit with TV and stimulate that nerve. That helps. Or with women, we can use intravaginal electrode. That helps. Sometimes, though, the overactive bladder is too much. So yes, they can go and have Botox injections into the bladder. So if nothing else is working, then you can investigate that, and that does work successfully for a lot of people. It doesn't always last, Botox, so you need to sometimes have it done again. That's more an urgency issue. Some people do have the stress incontinence, like if they're coughing or sneezing, sorry to point you out, but bending, lifting, moving. So sometimes with women, they can put a sling in, do a sling operation if physiotherapy doesn't work. And sometimes for men as well, they are also doing a sling operation these days, but it's not as successful as it is for women. And some men have had it done and then they still find that they're leaking a bit. So I think try physio first. I like to get men better before they go and have sling operations. Yes, but it is something that they can do. Years ago, they used to put in a artificial urethral sphincter in men, and has a little device in the scrotum, and so it holds tight all the time, and when you need to go and urinate, you press the device once and you urinate, and when you finish, you press it twice and it closes off. But that's for men that have really severe incontinence, that they will do that type of operation for these days. They're more likely to do a sling operation. But there is help out there.
Sorry, thank you. Yes, I had a radical prostatectomy exactly 12 months ago, almost to the day. And since that time, I've been doing I came here to the SAN and saw the physiotherapy department.
Yeah.
I forget the lass's name now. She was very helpful.
Yeah.
Gave me the exercises,
Yeah.
which I've been doing twice a day, at least once a day, preferably twice a day since then. But it still hasn't stopped in the sense of I'm much better. I can sleep pretty much through the night, maybe get up once or twice. And I find that was interesting, you were talking about how in the afternoon, it starts to, and that's where I find I can go quite well earlier in the day, and then in the afternoon it sort of starts to get me.
Yeah, very, very important is that's an endurance issue. And so the type of exercises you're going to do are maybe going to be aimed towards more endurance exercises.
Yes.
Okay, so if you can get good in the morning, you can get good in the afternoon. And it might be that you just need to tweak what you're doing.
Yeah, because I'm concerned because I've got to, the specialist said I'll probably have to, because my PSA is going up still.
Yeah.
So I'll probably have to come and have
some radiation
or something.
Yeah.
And so he's trying to get me as good as I...
Yeah. So it might need to be working on the endurance issue of your pelvic floor, because, it's like you're expecting it to run a marathon of 42 Ks, but you've only trained it for 1 K.
Yes. It was funny because I flew to Adelaide for one day, and I was absolutely dry all day.
Yeah.
Next day I was there, absolutely dry.
Yeah.
I thought, wow, I'm right now. Third day came back, I was right. And then it started again.
Yeah. And it does also depend on your activity levels, so it might be when you were in Adelaide you weren't doing too much, so it's kind of a false sense of I'm okay. Then when you come home and you start with doing things around the house and being active and all that type of thing, it just doesn't have the endurance. But I think it's a good sign. If you could get dry and improve, then you just have to work on it maybe a little bit differently to improve the endurance of the muscles.
Good, thank you.
Yeah.
So what's going to be different?
Well, he's going to want to try and hold on, maybe not doing the exercises, the 10 out of 10 ones, but then trying to hold on to the muscles in what's called like a sub-maximum contraction. So you're not holding it 10 out of 10, you've got it maybe 3 or 4 out of 10, but you're holding it for a long period of time. It might be like you marching on the spot, but you're holding your pelvic floor up for the whole time. You might be doing an exercise program, but you're really trying to pull up and hold your pelvic floor for a lot longer. Yeah.
Should I go and have some more physiotherapy?
Yeah, you can go and get some advice on that, or maybe change your exercise program. Sure.
When you describe the pelvic floor exercise, you talked about the sphincter around the scrotum and the penis.
Yeah.
I guess they're different muscle sets.
Yeah.
Do you recommend working them individually or all the time collectively?
All together. Who's got time to do it? They actually work all together a lot better. So it's just the different parts that you'll feel working. Okay, and so you will feel the lift of the anus, you will feel all of the front area working as well. So work them all hard together. That's my advice. Yeah.
I'm one of those unlucky ones who, after surgery, was 10 pad a day, boys.
Yeah.
Couldn't correct it. I had a sling put in, which has worked reasonably well.
Yeah, yeah.
But I still have a little bit of problem. Well, I did my pelvic floor exercises as much as I could, more than 3 times a day.
Yeah.
But is there still help available? I'm reasonably good, but by the end of the day, I'm not.
Yeah, so same thing, an endurance issue.
But if I cough, and I didn't a while ago, I'm all right then.
Yeah, but that's the thing, is that you have to learn, and it sometimes takes a good, 6 weeks. They say it takes about 1,000 repetitions before you will change your habit. And you've got to learn that every time you're going to cough or sneeze, that you actually tighten up. So it might be that, I'm sitting like this, but if I'm going to huddle over and cough like that, I'm adding more pressure down, and in fact, I've got to sit up tall, pull up. I won't cough, it makes a big noise, but pull up and have a cough. So sometimes it's your body posture as well. When you're going to cough, that will help you. And then it's also maybe the sling is helping, but it's not 100%. So it's working on, well, what maybe, and this is what you maybe need to go and sort out, what are my issues? Is it an endurance issue as well, that at the end of the day, yes, I have the sling, but if I had better muscle control, I might get better. Or even though I've got the sling in with coughing or sneezing, maybe if I do these little tricks, it might make it that I'm dry 100% with it.
I elected not to have radiotherapy because of it. And I should have, but I elected not to.
It doesn't mean that people having radiotherapy don't have issues.
No, but I didn't want to be any worse. At least I can live this way.
Yeah.
If it was as bad as it was chaotic.
No. There obviously was a lot more trauma to your sphincter than they would have liked. But, it's no harm in trying this.
No. Right, well, I had it TERP first.
Yes, that is
HIFU.
Yeah.
So I had quite a go.
Yeah, and I think that was why the sphincters had already been traumatised and damaged with the procedures that you'd had.
But I was as good as gold before, right?
But it had still, but it was like holding on.
Yeah, that's right.
And then this tipped you over.
Okay. Thank you.
No.
Yes, thanks for the talk, Karen. But when you're doing the pelvic floor exercises and you're contracting your muscles and holding for 10 seconds or whatever you're doing, how many of those contractions should you be doing each time
so between 8 to 12.
8 to 12.
Yeah, so if you want to improve endurance, then we try and get to 12. You can do a 10-second hold, but you can also try and extend that and hold for a bit longer. Yeah.
So you could go well beyond 12.
You can, but build it up. You don't want to...
And then following with these short contractions, letting go.
Yes.
What, about the same number?
Same number.
10?
Yeah,
right.
same number. We keep it simple.
Great. Thank you very much.
Yeah.
I think the gentleman beside you.
Yes.
Yeah, I mean, I had a prostatectomy 6 months ago.
Yeah.
My doctor would not operate till I'd done 6 weeks of pelvic floor exercise.
Oh, good. Excellent.
And I also went on a program afterwards.
Yes.
But one of the things that I found very useful was that the physiotherapist used an ultrasound on my perineum.
Yes.
So I could actually see, and he could see that I was actually doing the exercises correctly and could guide me about that. And he also each week monitored that so that over the 6 weeks he could actually see that it was getting stronger.
So I do have real-time ultrasound. A lot of physios have real-time ultrasounds, and you can see the lift, but you don't have one at home, so it's good for you to do your own self-examination and see yourself what's happening and can you hold on. The ultrasounds are also a little bit limited. They only show you the lift, they don't show you how much you're squeezing, but they're good. It's a good tool, especially for men. It's a really nice way to have a look at your pelvic floor muscles.
Second thing is what I found after my prostatectomy. I was continent within 2 weeks.
Yes.
Okay, so obviously the program that I did and perhaps other things.
And the surgeon, etc., all helped.
All those things. But what I found was that when my bladder got very full, especially at night, in the middle of the night, I would get a very intense pain, and I don't know if that's normal. I've just completed a radiotherapy sessions, 7 weeks, and that, whilst that disappeared a couple of months after, it's now returned. And I'm wondering, what's that related to? What might that be?
It might just be your bladder overstretching, that you're getting that real pain from it.
It's like it's so intense, it's almost like I'm not going to be able to hold till I get to the toilet. I do manage to. But
so that's real urgency. That's your bladder really maybe contracting down and, you know, with very full bladder. So hopefully that will settle.
Well, it's certainly settled before I had radiotherapy.
Yeah, but now since, it might have stirred it up a bit, and hopefully it will settle.
But if it's any consolation to this gentleman over here, I had radiotherapy and it did not affect my continence.
No, it's really good if you...
I ended up having a good experience. As much as this is a good experience. So it is good if you have good pelvic floor muscles. Oftentimes they like you after the surgery to improve your continence before they'll give you radiation therapy. So it's something that, and it's good that you had the time beforehand to work on your pelvic floor muscles. It's really, helpful to do that. But don't feel bad if you don't have that time to do it before. You can certainly do it post surgery and at any time. So even if your surgery was 12 months ago, don't just say, well, that's what I'm left with. The thing is that you've got to work on it. But having had, like I said, having had radiotherapy, keep working on your pelvic floor muscles because it does help the circulation. It's hard to know whether the pain's caused. I mean, you'd have to ask the specialist because of any damage or anything happening to the bladder or tissues around there because of the radiation. Yeah. But I do keep doing them every day.
Yes, every day. Keep it up forever. Yeah.
Is there one final question, perhaps? Down the front here.
I could ask a question, but there's a bit of humour in this. There's a bit of humour in this exercise. I've seen all of this and so on. I know it's difficult for some people, others it's not. But I can just think back to the early days. I could see a 3-part cartoon with 2 blokes standing next to each other at a urinal. The first one is when you're sprayed all over his leg while you're having a pee. The second one is squeezing your or milking your urethra, and the third one's a look of shock on his face while you're doing all of this.
Any more? Okay, well, thank you very much, Taryn. I'm sure everyone learned heaps tonight. I certainly did. And it's also a very good reminder for those of us who have attended your sessions before. I have, and it's a good reminder for me. Thank you so much for making yourself available to speak to us tonight.
It's a pleasure.
It's great to have you here, and I'm glad you had such a huge audience.
Such a lovely turnout.
That's wonderful.
Tonight. Thank you so much for
coming. So please join me in thanking Taryn.
Thank you. Thank you.